And so I'm delighted today to invite Dr. Tara Patricia Cookson. Tara is a postdoctoral fellow in the Department of Geography. She is a scholar activist whose research focuses on how we can influence policymaking and create caring priorities for women's well-being. Tara regularly hosts public lectures and recently spoke at the United Nations. And today, Tara will discuss, what can gender data teach us about COVID-19? And Tara, I invite you to take over the screen.
Great. Can everybody see my screen?
Yes.
Wonderful.
Yes, Tara.
Well, thanks so much for having me. It's a real pleasure. I'll foreground that I actually finished my postdoc just a couple of weeks ago, but I'm a very proud UBC alumna of the Okanagan campus for my bachelor's degree, and continue to sit on the UBC Alumni Advisory Council as well. I created this presentation actually in collaboration with my brilliant colleague, Dr. Julia Zulver, who is at the University of Oxford. And we know actually very little about COVID and its broader impacts, and what we do know is rapidly evolving. So the fact that Julie and I collaborated on this presentation together, I think is really indicative of what we're seeing more broadly across the world, with academics and researchers working together across fields, across geographies, to really make sense of all of this. So I'm probably not the only one who wakes up every morning to check the latest counts, the latest COVID counts. And the total count for confirmed cases recently surpassed 5 million. But this data doesn't capture the total burden of this disease, nor of its starkly gendered impacts. So in this lecture, I'm going to dive into what the coronavirus gender data tells us, highlighting what we can learn from unconventional data sources, including social media platforms and call logs at domestic violence shelters. And I'm also going to point out as we go along what policymakers can do with this information. But before I get going, I'd like to acknowledge that we are gathered today, albeit virtually, on the traditional, ancestral, and unceded territory of the Musqueam people. All right, so to begin, what is gender? So gender refers to socially constructed differences that exist along a spectrum. And we learn gender, we learn how to perform gender from a very young age. For example, what it means to be a girl or a boy in a particular society. And we may express our gender differently throughout the life course. And gender is different from sex, which refers to biological difference. Sex, be it male, female, or intersex, is assigned at birth. So gender data reflects and makes visible differences in the experiences, needs, opportunities, or contributions of women and men, girls and boys, and those who exist along the gender spectrum in all areas of life. It doesn't just mean data about women or sex disaggregated statistics, but these are a part of what gender data is. Gender data can be quantitative. For example, we can get gender data through census data and through national statistical offices. We can also get qualitative gender data through interviews and focus groups or analyses of participatory filmmaking. And we can get gender data from so-called big data, the large and unconventional data sets that are produced through this Zoom call, when we use our mobile telephones, when we get on an airplane, if you've got a Fitbit, we can garner gender-related insights from the data that is produced passively through these technologies. And gender data is used by policymakers, by philanthropic donors, by program developers and service providers. to develop effective policies, programs, efficient use of funds, and certainly at the moment, to develop an appropriate COVID response. Now, gender data is political and should catalyze action. We can collect data, gender data, just for data's sake, just to understand about the world. But having a feminist approach to gender data would also push us to think about ways that we can use it to make the world a more just and caring place. So the most kind of common gender data in the pandemic are quantitative data on confirmed cases and deaths. So Global Health 50/50 is an independent research initiative that provides sex disaggregated statistics on COVID. And the chart here shows that admission rates to intensive care units, broken down by sex across 10 countries, men in blue and women in yellow, indicate that men are much more likely to have severe health impacts from COVID-19. In fact, globally, we know that more men die from women, more men die than women from COVID-19. And this particular graph kind of shows the lead up to that, where men are actually needing more intensive medical responses. Their symptoms are presenting in a more severe way. So why is this important to know? What does it matter if we're all equal? What does it matter if more men are dying than women, or more men are needing health services in intensive care units? Well, this kind of data can help us understand how the virus works, and from this, what kinds of public policies are needed to curb its spread, and where to look for a vaccine or a cure. So from the initial kind of data points that showed that men were more likely to die or have adverse impacts, scientific researchers were able to do a deep dive and really dig in further and learn that comorbidities like heart disease, cancer, and diabetes that may present more in men than women are actually contributing factors. We've also learned and are continuing to explore the extent to which genes and chromosomes and hormones such as estrogen may provide us with explanations about why more men than women are dying. But these sex disaggregated statistics about confirmed cases and deaths actually don't show us the whole picture. So chief statistician at UN Women, Papa Sek, has made very clear that the pandemic isn't the kind of great equalizer like some have suggested. It's actually exacerbating pre-existing inequalities, many of which are intersectional. And so this means that people may experience COVID and the policies that are meant to curb its transmission very differently, not only according to their gender, but also their race or ethnicity, their sexuality, their age, whether they live in a rural place or an urban place, whether they live with disabilities or not. And this was made startlingly clear in the United States when New York City disaggregated its confirmed cases and deaths by neighborhood and by race. And we could see the African American and Latino populations were much, much harder hit. And I'd encourage you to go to the City of New York's webpage and look up those statistics if you haven't already. So to start, let's return to the sex disaggregated statistic about global COVID-related deaths and complicate the picture a little bit. So according to the Public Health Agency of Canada, 55% of confirmed cases within our country are actually women and 45% are men. So it's almost the reverse of what we see as the global trend. And 53% of deaths are women and 47% are men. So why is this? Well, when we dig in a little bit more and also disaggregate by age and apply a gender analysis, we actually learn that the largest share of cases and deaths, 82% in Canada, are in long-term care facilities or nursing homes. And in nursing homes, the majority of residents are women. So this statistic comes from the National Institute on Aging. So what does this all mean? Why is this? So women tend to live longer than men and thus require support as their bodies become more frail. They're also much less likely than men to live with a family member in old age. So this is why we end up seeing more women than men in long-term care facilities. So this is why we need a gender lens on COVID and an intersectional lens. Here we can see that gender, age, and the country context, where we have a bit more of a robust elder care system, all matter in shaping what comes out of this pandemic. So I mentioned before that what we know about the pandemic and its impacts is changing really rapidly. And the data that's needed to ensure that we have a really effective response and also an equitable recovery plan is actually in pretty short supply at the moment. And this is because it's really hard to collect data in the conventional ways. In policymaking, kind of a cornerstone of public policymaking is the data that we get from national statistical offices. So when you fill out your household census, that data that gets collected from every household across the country goes to really informing what kinds of public policies do we need. Child benefits, child care, family leave policies, these sorts of things, economic stimulus packages. But that data is helpful only to a certain extent right now because we're living in a really different world than we were the last time the census was taken. So collecting data really quickly is often done from face-to-face interviews or surveys where people can go door to door, participant observation, but we can't do that right now under stay-at-home orders. There's also certain topics that are really hard to get information about. For example, it can be really dangerous to ask a woman about domestic violence in an over-the-phone survey if a perpetrator is in the same room as her, overhearing the conversation. And I'm going to talk a little bit more about that particular case coming up. But we also need to think about the United Nations Sustainable Development Goal of leaving no one behind. And the lecture last week spoke a lot about the SDGs and the data that's needed for them. But if we're pivoting to methods of data collection that are more digital because we can't be in person, are we reaching the most vulnerable populations? Are we reaching people who don't have access to mobile data or a phone signal? Are we reaching people who don't have enough privacy to answer more intimate questions in a safe way? So in thinking through sort of what are the data sets that we have available and thinking through new methods for data collection, we need to think about whether or not we're reaching everyone as well if this data is going to inform our public policies. So in the following slides, we're going to examine a few cases. Data collection in the context of gender-based violence, unpaid care work, healthcare, migration, and leadership. And we're going to look at, one, what gender data across these areas can teach us about COVID-19, and two, what governments and international organizations can do to take action on this data. So the first, gender-based violence. So as the pandemic began, countries around the world started to enact strict shelter-in-place or stay-at-home orders. And this was really important to curb the spread of the virus. But there was a major unintended consequence of these policies. And we started to see this through call records from domestic violence shelters. So for example, UN Women has collected data from a whole number of countries about the number of calls that women's shelters or assault hotlines were receiving. And we see things like For example, in Cyprus and Singapore, a greater than 30% increase in calls as soon as the stay-at-home measures were put in place. In Argentina, some shelters were registering up to a 67% increase in calls seeking help. In New York City, web pages that offered online help for women experiencing gender-based violence or domestic violence saw up to a 3 times increase in the amount of web traffic. This isn't the whole picture, though. The same kind of data set from UN Women also shows that certain hotlines in Italy and France saw a 55% drop in calls as soon as the stay-at-home measures were put in place. We've also seen in several countries around the world a decrease in formal reports to justice officials like the police or social workers. And what this indicates through further investigation into what's going on is that in some contexts, women aren't able to find a private space to call or to be able to ask for help. Now, what can governments do with this data? Well, women in violent situations need more support than ever. This is why we were really pleased to see in Canada, the government announce the earmarking of $40 million for domestic violence shelters and an additional $10 million for Indigenous women and children back in early April. And they were able to make that commitment fairly early on because of data that had been generated from women's organizations, shelters, assault lines, starting back in China. And this sort of catalyzed a movement of grassroots women's groups collecting this data and making it available for public use. We've also seen another great example of action in the Yukon. So the government in the Yukon Territory saw that around the world domestic violence was increasing, and they knew this would happen very likely there as well. So with the closure of a number of important public services where women would typically go to access the internet, understanding that these would be closed and that staffing at domestic violence shelters would decrease, they purchased 325 smartphones with data plans, and they distributed them amongst vulnerable women with the hope that women then would have access to the internet in their own hands. We're also seeing collaborations with tech companies and gender equality focused organizations where these partnerships are exploring opportunities for understanding women's experiences of gender-based violence online, looking at online communities, searching keywords, looking for groups where women are supporting one another, looking for groups where people are perpetrating violence, trying to understand the patterns and trends, and then making sure that resources about where to go for help are targeted at those women who need the most, for example, through advertisements. Another facet of life deeply impacted by COVID-19 is unpaid care work, or what academics sometimes call social reproduction. And there's this really amazing feminist geographer called Cindy Katz, and she refers to this as the fleshy and messy stuff of everyday life. So care work, domestic work that's unpaid, includes nursing babies, cooking food, cleaning the house, doing laundry, soothing children, providing physical and emotional care for elder parents or for sick family members, and supporting people who are living with disabilities. So unpaid care and domestic work constitutes almost half of all global work time. And globally, women do 3 times as much of it as men. So researchers estimate that women's unpaid contributions to care equate to $11 trillion US. And this is largely a gender thing. This is about socially ascribed roles and responsibilities, where women are typically assigned responsibility for all of these activities. Not always, but socially, that's sort of typical globally. So with the stay-at-home orders that have been meant to curb the spread of COVID, we've also had a lot of children out of daycare and a lot of kids out of school. So according to UNESCO, 1.2 billion students across 177 countries have been impacted by school and daycare closures. Now that's a lot of kids that need caretaking and to have their time occupied. So this graph is from a recent New York Times investigation that asked adults in the US, who's spending more time homeschooling your children or helping them with distance learning? And men thought that they accounted for 45% of this time, but only 3% of women agreed with this. And in fact, actually, the graph for women aligns more closely with what we know about who typically takes responsibility for caring activities related to children's education as well, outside of the pandemic time. And we can learn a lot from previous pandemics. So we know, for example, that when care services and healthcare services are oversubscribed or shut their doors, women tend to pick up the slack. So studies that have come out after the Zika crisis in the Caribbean and after Ebola in West Africa showed that women were often the sole carers for sick relatives who didn't have access to institutionalized care in hospitals and clinics. And emerging data show that this pattern holds in the COVID pandemic. We also see, taking a gender analysis here a little bit further, that there are particular vulnerabilities faced by LGBTQ populations. So we know in kind of normal times that 2 times as many elder LGBTQ people live alone as straight people, and 25% of them receive care from friends. So if you think about that, what that means in terms of stay-at-home and shelter-in-place policies, isolation policies, this is a population that's affected by those in a very particular way and may not have access to the kind of care that they actually need, as their sort of care networks have been restricted. So what can governments do with this data, with this understanding, this knowledge? Well, they can ensure social protections for those with caring responsibilities, like paid family leave from work to care for sick family members. And because it's so challenging right now to balance paid work and unpaid care work, it's really important to ensure a basic level of income in Canada, like the CERB benefit, but very similar initiatives are happening in many countries around the globe. To provide a minimum level of childcare. You know, there's lots of conversations now about opening back up, but it's really important, particularly for gender equality, that childcare options are in place too, so that women can also go back to work. And public messaging campaigns that ensure and encourage kind of greater sharing of care responsibilities between women and men in the home. So that was unpaid care work, but also in paid care work, in healthcare and social care, including long-term care, like in nursing homes. 70% of those who work in these sectors globally are women. So this has an impact on women's own health during the pandemic. So the 2 graphs here are from Spain and the United States, data visualizations, again done by UN Women, that show that 3/4 of infected healthcare workers in these countries are women. So why does this kind of data matter? Well, it also shows that It also shows that as we're thinking about our policies to protect healthcare workers, that we also need to consider who's doing the work and what are their particular access to personal protective equipment, for example. So we've got community health care workers, and these in the whole spectrum of who provides care institutionally tend to be sort of at the very bottom kind of rung of pay, of worker protections, etc. And we know from a number of organizations working around the world that after a government stockpile of personal and protective equipment is kind of doled out and rationed out, it's those in the kind of highest paid and best protected positions that have it. So then when you have community health workers, a predominantly female workforce in very poor urban areas and very rural areas are doing their work, going door to door, communicating to people, their neighbors, about the pandemic, taking care of their neighbors without masks or hand sanitizer. So this kind of data can really catalyze governments to take extra precautions and ensure that all healthcare workers, regardless of where they are on the kind of health workforce hierarchy, get access to personal protective equipment. So I mentioned earlier as well that gender data can highlight women's multiple and layered vulnerabilities as well. And we're certainly seeing this in humanitarian crises and in conflict crises. So for example, the organization Women for Women International that works in the DRC, where healthcare infrastructure is chronically underfunded, is showing that actually what is available for women is really quite poor. So for example, in the DRC, there's $32 spent per capita on healthcare compared to $3,000 per capita spent in the UK. And as we mentioned before, when we have women who are picking up the slack of healthcare systems that just aren't able to cope, this is very much a gender issue. We're also seeing that there's restricted access to non-COVID related services. And this kind of non-COVID bit is in ironic quotations because actually COVID is impacting all areas of life. So we're seeing that, for example, services related to sexual and reproductive health care, homeless shelters, women's shelters, income generation projects are all being cut. And this is having really negative impacts on particularly vulnerable populations. So for example, Julie and I and colleagues from a number of other universities are working on a project on the Venezuelan-Colombian border in the context of the Venezuelan migration crisis, through which over 5 million Venezuelans have left the country over the past few years. And we're doing a data collection project using WhatsApp, the same kind of communication platform that a lot of us use to communicate with friends and family within Canada and abroad. But we're, through this data collection project, we were able to see that as soon as the government shut down kind of public access to a lot of humanitarian services in order to contain the spread of the virus and keep people in their homes, migrant women were reporting that with a loss of income, with a loss of access to cash transfers, and with an increase in xenophobia against foreigners who were perceived to be the ones spreading the virus, that they were losing their access to housing, and we were actually seeing a rise in women who were sleeping on the streets, migrant women sleeping on the streets. So again, why is this data useful? Why is this data important? Well, this data, that collected through WhatsApp, that Women for Women International is collecting in the DRC can be used to advocate for services that specifically meet the needs of vulnerable populations, whether these are shelters or access to cash or contraception, etc. It's during crises that these services are the most kind of likely to get cut, but also when they become the most essential. And finally, women's leadership. So linked to gendered norms around care work, we know that women leaders, particularly in conflict zones, often have to undertake work in their communities in dangerous and violent contexts. So Julia's research in Colombia, which is experiencing a reconfiguration of a decades-long armed conflict, provides a really great example of this. So her research actually shows that the biggest risk for women social leaders in Colombia isn't actually the virus itself. It's the rise in violence and insecurity against women leaders, women social leaders. So what she's documenting is armed groups taking advantage of the pandemic and resulting lockdown to expand their territorial control. State institutions, meanwhile, and international organizations have suspended their work. So women are providing humanitarian aid like food and supplies in their communities to neighbors who are in need. They're also unable at the moment to access the justice institutions in the rural parts of the country, which are shut down during quarantine. So meanwhile, during all of this, women social leaders are receiving threats, they're experiencing violence, and indeed there's been a rise in murder because of their community work and because they're so visible out in the community. So this particular, these pieces of data come from Julia's recent interviews and close reading of newspaper reports, which can be another source of data when in-person interviewing, et cetera, isn't an option. So this data doesn't show up in crime figures because women are unable at the moment to report what's going on. But it's really important because it shows us that women who are often encouraged by international organizations and by state governments to be peace builders in their communities and to go out and do the kind of community work, making sure that people are okay in crises, it shows that these women are doing so at great personal risk. And so it's an important data point for arguing for support for them. So just to close out, I mean, this presentation has certainly demonstrated how the pandemic is exacerbating gender inequality around the world. And sadly, this is the reality. There's actually a great fear in the international community that as large donors, philanthropic organizations from like the Gates Foundation to the Rockefeller Foundation, et cetera, as they sort of like tighten their belts for next year's budget after having spent so much money this year on keeping the pandemic kind of as contained as possible, that gender equality will be one of the first things cut from kind of donor and funding agendas. So this kind of data generation is really important to keep it really at the forefront and ensure that we keep making progress on gender equality. So here we're citing Britta Fernandez-Schmidt, the Executive Director of Women for Women International. So she, like us, has some concern about how the global pandemic will disproportionately impact women, but also is looking forward. So she writes, COVID-19 has served as a reminder that the existing long-term challenges we face as a global community are exacerbated in times of crisis. And while the challenge is great, governments and international institutions can still make 2020 a year of critical action for gender equality by setting a pathway for a more just, equitable, and resilient post-pandemic world. And certainly the group of researchers I collaborate with and that Julia collaborates with, we're witnessing an incredible force of collaboration between academics and policymakers, between grassroots feminist organizations and governments, NGOs, tech companies, and the media. And we're hopeful that this will continue and continue to catalyze action into the future. Thank you.
Thank you, Tara. I'm going to move over to our questions platform now, and I'll just remind people who arrived late how to access that. So I'm inviting them to open a browser and type Slido, slido.com, slido.com. And our event code today is EXL526. I'm going to move over there now. I just want to check that you see the question screen. Tara, can you see that?
I can.
Okay, so I'm going to highlight the questions. I'm going to read it out to you to give you a moment's pause to think about the question. So the first question. So the first question, Tara, is when doing trials to test for vaccine, will they ensure different genders and races are represented in the testing groups?
This is such a good question, and I'm going to preface it by saying I'm definitely not a public health expert. However, I do know that a very serious and kind of, until more recently, little discussed problem in medicine and in pharmaceutical development is that testing didn't account for gender, didn't account for sex. So even when we're doing tests on mice, typically male mice are chosen for these because they don't have a menstrual cycle and are sort of considered to be a little bit more stable. So this, in the end, really does present problems from a biological perspective, from a sex perspective, of how our different kind of vaccines and cures, et cetera, are suitable. I don't have an answer for whether or not pharmaceutical companies will ensure that different genders and races are represented in testing groups, ages as well. I would certainly hope so, and certainly over the past year, there's been enough discussion about this sort of thing and the need for it to kind of like push pharmaceutical companies to do the right thing. Something else to watch out for as well is the pricing of those vaccines or any other cures that are developed, and whether or not those will be made affordable and accessible to different groups by gender, by race, global south, global north, etc. And that's probably going to require a lot of activism on the part of regular people like us to sort of demand that there is equitable access.
Great, thank you, Tara. Will this hinder women going back to work or applying for jobs, as they may be more likely to have a gap in work due to added responsibilities during this time?
Absolutely. I mean, I have to say, one of the things that I probably get the most emails about at the moment, and my particular kind of area of work is around social protection. So sort of around like family leave policies, economic empowerment, this sort of thing. One of the things that I've been asked the most about over the past kind of like 3 or 4 weeks, as countries are starting to say, okay, we're going to have our like opening up policies, our back to work, back to business policies, is from women saying, well, wait a minute. I haven't heard anything about my daycare opening back up. So what are we going to do here? And that's actually, really problematic from a gender perspective, because while it's great to have someone at home and like taking care of the kids, there's been a lot of progress made in a lot of countries globally towards women having access to their own income. Also, when we consider that many of the sectors that have been kind of the most tightly closed down because of the pandemic are like the service sector, where women are actually disproportionately represented as well, and where in fact many members of the LGBTQ community work as well. So it's women and it's a lot of other marginalized populations as well. So this is
And
another area where we need to be advocating for governments really to, what are you putting in place for childcare? How
right,
are we responding to that?
right. And people are hearing, but of course, it's like children are back for 20%, 40% of the time. So how
Exactly.
helpful is that? How realistic is that? But it also brings to mind that interesting slide that you had, Tara, where women and where partners had very different picture of what they felt their partner was offering. Like, do you have any sense of like any what you think about that big differentiation between the partners considering their contribution to the
Yeah.
care and household and
Yeah, I mean, one of the things to think about and to consider as well, and this isn't starting just with like fresh data from COVID, but like drawing on what we know from decades of feminist research and feminist economic research in particular, um, is all of the different activities that go into kind of care and domestic work. So we know that, for example, when there is care of an elder parent involved, for example, women might be more likely to do the kind of more emotional labor, some of the more physical labor, like if there's bathing required or this sort of thing. And men sometimes tend to do the more like managerial level things or organizational level things or the grocery shopping. And what we're actually seeing in COVID as well is from where the data is available, kind of similar divisions of tasks and labor. So we're seeing that men are playing with children a lot more than usual, and more than women. And women are doing more of the cooking, the cleaning, and the educating. But some of where the kind of fuzzy bit goes is like, where does education bleed into playing at the moment? And so this is stuff that, it's only going to be with further research, and, we're going to be 3 years down the road and looking back, and we're going to be able to explain that graph in a little bit more detail.
right, great. Thank you, Tara.
Yeah.
So next question, is women's increased unpaid labor during COVID, such as unpaid childcare for children during school and daycare closures, being considered in gender inequity?
Yeah, so I mean, certainly when gender first started being talked about with COVID, first it was around gender-based violence, and there were like all these alarm bells going off. And then it really, the conversation kind of became enriched by thinking about unpaid labor, and the childcare and daycare closures, et cetera. And I'm sure that a lot of you on the call today have also been in Zoom calls or in conferences or whatever, where the child runs, zipping through the background or whatever. And I've certainly had that with men and women on the other side of that. But I think, I'm hopeful that, much like with gender-based violence, where there was all this data and then governments actually did start responding. I mentioned policy responses in Canada with the cell phones in the Yukon, and the federal government earmarking funds for women's shelters and online services. In Nepal, for example, the government is providing unconditional cash transfers, kind of like the CERB benefit, but to women who are experiencing gender-based violence, so that they can actually leave a violent situation and rent somewhere else. So I'm hoping that when it comes to unpaid labor, as more of this kind of data comes out, and more data and more women speaking up and saying like, hey, how am I going to go back to work if I don't have childcare, that we'll see similar creative policy responses with that as well.
Thank you.
Yeah.
So Tara, next question, is there any data on gender bias and whether women with symptoms may have their symptoms attributed to anxiety or psychological factors when trying to get tested?
Yeah, I haven't actually seen any data on this, which is certainly not to say that it doesn't exist. But, even if we look at with heart attacks, for example, how women are often get misdiagnosed because their symptoms of a heart attack present differently than men's symptoms for a heart attack. I would imagine that this is a really rich area for inquiry. Some interesting data around the kind of anxiety or mental health piece, which I think also requires further investigation kind of across the gender spectrum. But something that I saw that was very interesting the other day, and I can't remember the exact figures, but when you ask women and men, are you worried about getting COVID yourself? Their response rates were about equal. But when you asked them, are you worried about a family member getting COVID? Women were way more worried about that. They experienced a greater deal of anxiety or on a more continual basis. And that goes back to thinking about, that's not biological. That goes back to thinking about, the socially ascribed gender roles and responsibilities where women are assigned, care of those around them.
Mm-hmm.
Sorry that I don't have a very specific answer on that, but I'd be happy to find that particular study and follow up. You'd be welcome to email me as well.
And I'm just, a question just came in. I'm just going to push it to the top because I feel it might be similar, and then I segue into what you've just discussed, or maybe not. Why isn't there more thought put into how, if female bodies are considered too unstable to test on due to menstrual cycle, drugs may affect them differently?
I think there is a lot of thinking about this, actually, and it's there's the process of something that's just sort of considered status quo and taken for granted, and then people start to dig into it and say, like, hey, that actually shouldn't just be the assumed way things are. We shouldn't only test on male mice because they don't menstruate. So there certainly is a movement within scientific, medical research to work on this as well. And even more in popular literature, we're starting to kind of think about gender design and bias in design as well.
Okay. Based on some of the issues you present, why not talk about vulnerable people approach rather than gender approach?
Yeah, absolutely. I mean, I think a lot of the time we just need to call a spade, and gender inequality is just a thing. And so if we don't call it out, if we don't address it, if we don't identify it and treat it head on, then it's kind of more likely to kind of float away by the wayside. And that's the same reason why, we talk about sexism and racism and ageism, etc. So we want that kind of very pointed engagement with different inequalities so that we can make sure that we are actually addressing them in the right ways.
Okay, thank you. So Tara, would a universal basic income as a result of this be useful in helping ensure better equality, as women are doing so much of the unpaid labor?
Yeah, absolutely. So there's such a renewed kind of discussion about this at the moment. There's this movement for universal basic income, and I don't know how many on the call have followed it when it was going on in Ontario, before it sort of got squashed by the current provincial government. But over the past kind of like 10-ish years, but really it kind of peaked maybe 2 years ago, there was all of this discussion in Switzerland and in a number of countries in sub-Saharan Africa, in parts of Canada, about universal basic income. In fact, even Andrew Yang, who was running for president in the United States, that was like his whole platform. So this kind of sort of died down over the past 2 years, this conversation, and all of a sudden it's sort of like the top of people's minds again, and economists are saying like, and feminist economists in particular, saying like, hey, we should really revisit this, and this is the exact moment at which this is, needed, particularly as we're thinking about building back. This pandemic has really laid bare the enormous gaps and the very serious fissures in our social protection systems, the systems that are composed of child benefits, of family leave policies, maternity leave, these sorts of things, access to health care. So I would hope that there is some, some real kind of concerted conversation about this, because the research actually does show that a universal basic income can do a lot for sort of equalizing across gender, across race, across social class, etc. And so time will tell. There will be studies that'll come out of the countries that have imposed something very close to this. And, what happened? Was it positive? Was it negative? And then, political movement builds around that. But I'd encourage you to look up Ugo Gentili, UGO. He's an economist who puts out a weekly newsletter, and he's kind of tracking where universal basic income and different cash benefits, including the CERB, are kind of surfacing in relation to COVID across the world. I'd be happy to share that link as well.
Okay, and I just saw a question on employment coming in earlier, just staying on the theme of employment. Just this one for now. Since women are being affected rework, how is that affecting men's jobs?
Mm-hmm. Absolutely. So this again is the thing about looking at, looking at gender as not just women. So we can look across industries, we can look across sectors. Obviously, COVID is, it's impacting everybody. A lot of frontline responders. So my brother-in-law is a firefighter, and he's been, firefighters, at least in British Columbia, are typically the first to respond to a health crisis even before someone with an ambulance gets there. So he's really seeing how his work and COVID come together and then impact, the whole family, etc., his own exposure. But we're seeing in construction sector, for example, where men are kind of the dominant laborers, great reductions in this. We're seeing in the US and in Canada to a lesser extent, but in the kind of meat packing sectors, where there's a lot of men working in there, and a great deal of kind of COVID running rampant in those really precarious work environments. But if we actually are looking by sector, we are seeing that it's a lot of the layoffs have been in the service sector, where it is predominantly women, which is certainly not to say that it isn't affecting men's jobs. And so we are needing to look at all of that data as well.
Okay, it's early days, yes, right. Have you any sense, Tara, on how this has impacted women going through pregnancies and childbirth during this time?
Yeah, absolutely. So a lot of hospitals have imposed regulations. This was certainly the case in the US. I've heard some of it happening in Canada, although I'm not totally sure to what extent. It's definitely happening in other countries around the globe, where women are giving birth without their partner present, or without any other family member or supportive person present. And I think we really need to kind of weigh the health benefits of that particular policy against what that actually means for women. And certainly we're seeing some studies that are coming out of East and West Africa about women giving birth at home much more often than in a clinic. And the kind of thinking behind this and the sort of early days research behind this is showing two things. One, that women are really afraid of contracting COVID in healthcare situations where the institution is just completely overburdened. So may feel safer giving birth at home in that instance. And two, that they aren't allowed to give birth with their partner, or believe that they aren't. So I think this is something, and certainly after Ebola, we saw that one of the lasting effects of the Ebola crisis was really poor maternal health outcomes for a long time following, because of divestment in maternal health care, because women hadn't been able to access the necessary kind of pre and postnatal exams. So it's something that really needs to be watched for in the COVID pandemic as well.
Okay. Thank you, Tara.
Mm.
Tara, what is the fear of this virus that brings out the worst towards vulnerable groups?
Absolutely. So I have 2 points that I'd like to kind of make around this. One is in around what some governments are using the COVID pandemic as an excuse for. So, for example, you see in Hungary, where the government made kind of a grab at executive power to under the guise of kind of COVID and needing to do an emergency effort and have an emergency protocol, much like we have in Canada, but where within all of that they managed to slide through disallowing identity changes for transgendered people. So you've got that happening. You've got in other countries where governments are cracking down on shelters where it's primarily LGBTQ people who are living under the guise of sort of breaking down groups of more than 10 people, but actually using the police to exact extreme violence on these populations. And there's a really good Human Rights Watch report that came out of Uganda on that. So you're seeing governments that already had a propensity towards in particular, a very homophobic policy. We're seeing them actually take advantage of the current context to get away with a whole bunch of really horrific abuses. At the same time, something that I've seen that's really interesting from the data perspective, and it was on UBC Oris's Twitter account the other day, was a group that was doing community reporting of anti-Asian racism in Canada. And so they were actually able to visualize, for example, that 53% of kind of COVID-related racist attacks were happening on sidewalks. So like really interesting things that, we don't need the data for the data's sake. Again, we need the data to be able to help us like make public policy campaigns and like public messaging campaigns that break down really kind of racist and xenophobic misinformation around the virus and how it spreads, etc. I also mentioned the case that we were seeing on the Venezuela-Colombia border where migrants were losing access to housing as the host communities were kind of pushing them out with fake news that, Venezuelans were bringing the virus with them from Venezuela, which, wasn't true.
Mm-hmm.
So some very interesting, efforts to combat this, including from within our own UBC community. So that is the kind of bright side or kind of work that's being done to make things better.
Yeah. I saw last night for the first time an advertisement on TV focusing on women who are in domestic violence situations and speaking to what you were speaking about earlier, where they're feeling unsafe and they can't engage in a telephone conversation. So with a coded conversation, there are hand signals now, like universal hand signals that women can use, or men, I guess, if when should that and when if that occurs, and that they can use hand signals to let that person know that I'm in danger, send help. So I thought that was interesting. It's obviously a good approach there. This leads into that question. Leads into the similar. Do you think government should have consulted vulnerable groups and thought about factors such as domestic violence before shutting these services down?
I mean, I have to say, so I had the great pleasure of working on a report with UN Women last year called Progress of the World's Women 2019-2020, Families in a Changing World. And this report takes data from researchers all over the world and kind of comments on and sheds light on different trends and issues. And this particular version of this flagship research report was on family life. And it really showed that home is not always a safe space for women and girls. And for other marginalized populations, including, LGBTQ people. So holding that data and that information kind of in my mind, as soon as the government started putting these like lockdown measures in place, I was having conversations with other women. No way that this is going to be good for women. And then sure enough, the data starts coming out. So absolutely, this is why it is so important that policy-making bodies in our governments, but also in the companies that we work for and the institutions we work for, do gender analyses, that as part of the process of formulating any kind of policy, including an emergency policy, that there is really substantive representation of the groups that the policy is going to affect. And to be fair, there are a lot of governments in the world that as soon as the data started coming out, from other contexts or from within their own context, they pivoted. But that should really be baked into the policymaking process from the beginning. Because again, in the Zika and Ebola context, there was also a rise in domestic violence as there were kind of like more kind of stay-at-home measures imposed there as well.
Mm-hmm. Thank you, Tara. And the next two questions are kind of similar. So we'll take them together, I think. Why does violence happen in times like this? And why do women try to make it better? Or why do women that try to make it better? Yeah, I'm guessing it's why do women try to make it? And then why don't governments make it illegal to have violence in any manner during this time?
Yeah, absolutely. So, I mean, violence against women, violence against anybody is a fundamental abuse of a human right. So it should be illegal and not condoned in any context. However, violence and violence against women is a reality even in places where it isn't illegal. And I mean, or where it is illegal rather. So, I mean, we see this in Canada. I mean, we've had data on violence against women, very good data for decades, and yet we still have it. So one of the reasons why it becomes exacerbated in times like this, and that's not only in times of kind of like lockdown or enclosure, so where you actually have a perpetrator of violence and a victim or survivor of violence in the same place. And, if they're in the same place all the time, that's obviously going to increase likelihood. Especially when a woman is unable to say, like, go to work, and sometimes work is more of a safer space. So that's one thing, but also in times of stress. So we saw, for example, after the financial crisis, the 2008-2009 financial crisis, we also saw a rise in domestic violence against women. And it's attributed to an increase in stress, an increase in substance abuse, alcohol and drugs, that then ends up getting taken out on women or on children. We're also getting reports that violence against children is up right now. So this is something that we know always happens in a crisis. It happens in humanitarian crises and conflict zones as well. And it's something that governments just have to have at the very top and front of mind in designing not only response policies like right now, but we need to be thinking about it if indeed we are heading into an economic recession as well. There needs to be funding that's earmarked for prevention and response to violence. And that's not only response in the sense of shelters and hotlines, et cetera, but also work with groups who are at risk of perpetrating. And there's a lot of great organizations in Canada that are doing work with men, with young men, to prevent the perpetration of violence. And Next Gen Men is one that's got presence in Vancouver, Calgary, and Ontario that I encourage any of you to look up to. They're doing really great work.
Thank you, Kerry. And I realize I didn't call time at 2 o'clock. My apologies. It's actually 2:09. I've got one final question for you, Tara, before we close. From a gender perspective, is it also concerning that underpaid daycare workers might be forced to go back to work early in a potentially unsafe environment? Which I guess you...
Totally it is. So there's going to be like a lot of work that needs to get done here that, first of all, that nobody's forced to do anything. But second, like a lot of work with workers and with workers' representatives, whether that's unions or not, and daycare workers aren't typically unionized, but with their representatives, for what is actually needed in making daycares like a safe place to work, making sure that there is the right kind of personal protective equipment available for all of them. Is the kind of ratio of daycare worker to child feasible, so that
Right.
that's manageable as well, because you've got little kids that are wanting to hug each other. They haven't seen their friends in a long time. They're wanting to use the same Play-Doh, like all of that. So there really needs to be a lot of thinking around that. And there are organizations who are working on it, like everything from the International Labor Organization at the top kind of multilateral level, thinking about worker protections, all the way down to actually consulting with daycare owners and providers, and our educational institutions where our daycare workers are also trained. So further work needed there for sure.
And have access to paid sick days, right?
Absolutely.
Yeah. Okay. Thank you so much. That was our last question. I'm going to go back to our final slide. Tara, are you seeing my final slide that says a big thank you?
Yes.
So yeah, big thank you to you, Tara. I really enjoyed that lecture. Thank you so much. I learned so much today. Just to remind our participants to thank them for their great questions today, which always adds so much to the presentation, I feel. But just want to remind them to subscribe and to our website and be the first to know what our plans are for the fall. If they have any questions, they can contact us at info.exl@ubc.ca, or our colleagues are available at 604-822-144. And one last thing, do remember that today's recording will be on our YouTube channel very soon. So that's just a final goodbye, and stay safe, everybody. Take care. Bye-bye.
Thank you.
Thank you.